Good evening, everybody. Well, good evening where I am. It is 8:30 p.m. where I am in London. If you're joining me from anywhere around the world, good evening, good morning, good afternoon, whatever it is. This is live right now, but if you're watching it on on replay, hopefully you'll still get a lot of value out of it. Today we're mainly talking about lower back pain. So if you have any lower back pain related questions, please stick them in the chat. Boyan, good evening. I have received your question, so I will be answering that later. I'm just trying to use my phone to check the chat as well. So if you see me looking in multiple directions, that's why. Hopefully you can all hear me okay. If there's any audio issues, please let me know. We're about 30 seconds delayed, so it's going to take me a while to see any of your comments or questions. So let's get into it. Today we're talking about lower back pain. I want to know really from you if you've got back pain, if you've got any back pain questions. We're going to keep this fairly informal, so I want you to feel like you can ask as many questions as you like. I will try my best to get back to all of them. If it's something that is maybe a bit complicated or not quite relevant, then I might just do that in a private message. Tammy, good afternoon for you. So if you have any questions, let me know. So we're talking about low back pain today. Hopefully you can see that. So yeah, like I say, today is all about what you want to know. I'm going to treat today as though you don't know an awful lot about lower back pain, or if you do, I'm going to assume you have lower back pain, and I'm going to talk you through from the start and what I would do to progress through to getting out of pain and staying out of pain. So it's kind of from beginning to end. That's just how I'm going to riff for today. But like I say, I'm going to try and focus on your questions. So if you have any questions, do let me know. So like I say, let me know if you have any questions. Now, who am I? I know a couple of you watching already know who I am. But if you don't know who I am, I'm Ashley. You're obviously watching me on YouTube. I'm based in the UK in London. I'm an osteopath. I also do something called functional medicine. So essentially what that all means is I help people get out of pain. Most of the time people come in with musculoskeletal pain. That could be necks, shoulders, backs, knees, anywhere from head to toe. I also help people with their health conditions. I don't advertise the functional medicine side of things as much, but sometimes when people come in, they have all sorts of things going on. So let's say you're coming in with lower back pain. There might be other things like high blood pressure, high cholesterol, maybe you've got type 2 diabetes. So as a practitioner, I help you to overcome those things as well. And that can be through nutrition, lifestyle, sleep, changes to your digestion, supplementation, that kind of stuff. So that's a little bit about who I am. Like I say, who here has lower back pain? If you have lower back pain, do let me know. And let me know if you know what your diagnosis is. Let me know if you have any questions around your diagnosis, around your rehab plan, whatever it is, let me know. I have a few of your questions already. So the lower back is very well, not just the lower back, but the body is very complicated. The point of this diagram that you're seeing, or hopefully you're seeing, let me know if you can't, the point of this is to show you the complexity of the back. Not just the back, but there are multiple layers of muscle within your body. What you're seeing here is a combination of the outermost muscles, which you're seeing on the right hand side, and then on the left hand side is sort of one layer a bit deeper. If we take a little step further in to that kind of deeper layer, this group of muscles, what you can see here is the erector spinae. Can someone just let me know if you can actually see this, or if I'm just talking about the slides and you can't actually see what I can see? So these are known as the erector spinae. These are your posture muscles. As you can see, they kind of start from the upper back, but actually in fact they go all the way from the neck. So if I move my mouse, they actually start right from the base of the skull. So they go all the way from the base of the skull right down the back, right down to essentially the sacrum. These help you keep yourself upright. A lot of people have issues in these, and I will touch on this in a little bit. Right now, the point I'm trying to make is how complex this is. Now, if we zoom in a little bit closer, again, you can see a lot more very, very small muscles. I have a model here. If that will help you, hopefully it will. So some of you may have seen this in some videos before. This, what you're looking at right now, is a model of the pelvis and lower back. As you can see, there are a lot of different muscles. So over on this side here, this is the sort of more outermost. Let me just open that up so you can see. So over here, this is the outermost layer. This is the outermost layer of your erector spinae. You know, it comes all the way down, attaches onto your sacrum. If we were to take this layer away, we have a lot more muscles that go deeper. And as you can see, there's muscles that go between vertebrae, and there's muscles that go between the spinous processes, and muscles that go kind of more oblique. These are known as the multifidus muscles. So all of these, when you have lower back pain, all of these potentially are involved. So don't just think of lower back pain as though, one second. So don't just think of lower back pain as just one muscle. Anytime you have pain, there's going to be multiple muscles involved. So that's why it can be so complex to overcome your back pain. Now, as I was saying about the postural muscles, I'm going to go back to the slides because that's a good place to start. Let's go back to the slide. So here we're looking at the erector spinae. Now, I'm going to kind of cover the most common things I see, but the erector spinae is one of the most common areas that people end up having pain. Can you see where it kind of goes from that orangey coloured down into that white colour here? So this is the muscle. This orangey pinky stuff is the muscle. As we come lower down, this is the tendons. Just out of interest, do you know the difference between a tendon and a ligament? I will cover that in a second. I'm just gonna wait a second just to see if what people's knowledge is like. These erector spinae are one of the most common causes of lower back pain. Usually when this is the case, people will have pain on just one side. Usually just down here. I don't know if you guys can see. Can you see my mouse wiggling around? Otherwise, if I'm wiggling my mouse around and you can't see it, then you're probably like, what the hell's going on? So where the white comes down and attaches near to the sacrum is where I'm pointing. What happens is a lot of people are fairly sedentary, or at least don't strengthen their backs. Most of the people I see in practice are office-based workers. And if you're maybe watching this from the office right now, then obviously I appreciate that. Hopefully you don't get in trouble. A lot of people spend a lot of time sitting. That means these muscles in your lower back get weaker. And over time, we can sometimes do a lot of repetitive things. So let's say you're sitting all week at your desk. Then at the weekend, as the weather starts to get better, you might decide you want to go out into the garden and start doing some gardening. So you're sitting or you're crouching or kneeling, and gardening can be a very repetitive thing. Or sometimes people might be moving house, or they're doing housework. So all of these things combined with these repetitive things that they're doing end up making the muscles fatigued. At some point, those muscles have reached a point where they can't handle any more. Then you go and pick something up off the floor, something like a pencil, or you lean over the sink to brush your teeth or wash the dishes, and all of a sudden your back just goes. Now this is a very, very common problem. So what's happened is those muscles have become so fatigued, they've had enough, and they've locked up, they've gone into spasm. This can lead to very acute pain. It's difficult at that stage to tell whether it's the muscle, disc, ligaments, tendons, etc. What we're talking about here is the tendons and the muscles of the erector spinae. So people go into spasm, can't move, and it could take anywhere up to a week, 2 weeks, 3 weeks for this pain to subside. We will cover, what I will talk about today, the phases, which I'll cover in a minute, is essentially how we fix this erector spinae issue. So the first phase, I'll come on to the phases in a minute, but this is a very musculoskeletal issue. There are, of course, other issues that can happen. So I'm going to just hop over to a PDF. Let me just escape from this. All right, how do we come out of this? Go into PDF. Right, so hopefully you're seeing a screenshot of my cover of my lower back pain ebook. In here, I go through a lot of information about what lower back pain is. What I'm coming to is the discs. Now, again, you can see the anatomy. There's so many muscles involved. What I've just shown you on the other slides is just a very, very small portion of the anatomy in your lower back. Now, we can go deeper, and we've got the quadratus lumborum, and then we can go into the front side. We've got the psoas and psoas major. Then we've got the glute muscles. All of these are involved when it comes to lower back pain. What I want to get onto is the discs. Now, a lot of people with lower back pain, discs are one of the more common reasons for lower back pain. Let me just ask you, do you know what the difference between a disc and, no, not difference, do you know what an intervertebral disc is? What it looks like, what it does? Let me know in the comments. Which reminds me, I didn't answer the question of tendon and ligament. So if you don't know the difference between a tendon and a ligament, a tendon attaches your muscles to the bone. So in the case of, let me just go back to me. So if you're looking at, say, a muscular model, anywhere that these muscles attach would be tendon. So actually this area here would probably be white and not this browny pinky color. So the tendons are attaching the muscles to the bone. A ligament is attaching a bone to a bone. You get a lot of ligaments in joint areas such as your knee, shoulder, elbow. Anywhere you've got a movable joint, you have a lot of ligaments. So that's the difference between ligaments and tendons. Hopefully that makes sense. Now, the discs in between the vertebra, think of them like cushions. Think of them like, I always describe them like jam donuts. Imagine you've got a donut, and in the middle you've got a section of jam. So as you squish it, it's like a cushion, and as you squish at different angles, that can cause the jam in the middle to shift. What can then happen is you can end up with something like a disc prolapse. Now this, hopefully you can see this. This is just a nice little diagram of a disc. In the middle, you've got this kind of bluey substance. This is the nucleus pulposus. That's the jam I'm talking about. The disc itself is made up of rings. Now these rings, think of them like onions. Think of them like the layers of an onion. They can get worn down. And what can end up happening, let me just skip over here. Can everyone see the ebook? Can everyone see the pictures I'm showing on the screen? Let me know. So here we've got kind of a diagram. How can I zoom in? Let's zoom in a bit. Right. So here we've got a nice little diagram of the discs from above. On the far left is a normal healthy disc. Now, these layers around the disc, think of them like onions. Over time, sometimes those layers can become worn down. They can get thinner. Now, as you put pressure through your discs, those layers can become worn down. So what we can then end up with is a disc bulge. And that's what we can see in that second picture. That disc bulge can sometimes be not an issue at all. Potentially, I have a disc bulge and I don't even know. Many people have disc bulges and they don't even know. The problem happens when those disc bulges start becoming bigger. So they start compressing on the nerves. So what we can see is these yellow things popping out from either side. These are the nerve roots. So these are coming from your spinal cord and then branching out, and these are what end up supplying your limbs or your extremities or organs. So what we can see is in the second picture, this nerve root starting to become pinched. Now, in some cases, that might not be that bad. In some cases, it may not even touch the nerve, but yet can cause people excruciating pain. So sometimes the extent of the disc bulge or disc prolapse doesn't always correspond with the amount of pain that someone's in. Now, if those, oh, what have I done here? What have I done? Let's try this. Right. If those layers of the disc become torn, what can happen is the material on the inside, that nucleus, can start to bulge out. When that bulges out, that's when problems really start to happen. The body is not used to being exposed to that material. So soon as that material pops out, there's almost like a real inflammatory response, like an immune response, and a lot of pain. That's when these disc issues can start causing quite a lot of issues. So that's what we can see in number 3. And in number 4 is kind of where the material has kind of dissipated and become less of an issue. This is more of a chronic disc issue. Bohan, I have got your question. I'm going to answer that in a minute. Let me just have a quick look at Tammy's questions. I think Tammy might have put a question. Okay, so Tammy, I don't think it's a question, but you're basically saying your back pain, you've had it for years and it's getting more frequent over the last few months. Is there a question attached to that, or am I kind of riffing off that and explaining what I would do? So let me know if there is a question based on that. So going back to this. Okay, so we've done a little bit of the anatomy. Hopefully you understand the complexity of the lower back. One of the most common questions I get asked is, do I need an MRI? MRIs are useful. Thank you, Tammy. I've just seen your answer. MRIs are useful, but they're not always essential. When someone comes in to see me, the only time I would clinically send someone for an MRI is if the pain is so bad that, or the symptoms match that of a disc. So let's say someone had inability to move, they were experiencing shooting pain down one or both legs. That's not always a cause to send someone for an MRI. But if they had, let's say, what's called saddle anesthesia, which is where you get numbness on the inside of your thighs, that would probably be more of a cause to send someone to the hospital. But if it was not associated with difficulties passing water, then I might be like, okay, go for an MRI. If someone had lost the ability to go for a pee, that would be an instant hospital referral. Now, if someone came in and they weren't that bad and we treated them for, let's say, 3-4 sessions, but the pain wasn't getting better, then it might be like, okay, let's send you for an MRI. The problem with MRIs, or any scan for that matter, is that the images you see do not always correspond with the pain. Now, if I was to take myself for an MRI, there is a chance that I could have a disc bulge or a disc prolapse. But right now, for myself, I don't have any pain. I don't have any back pain. I have had history of lower back pain, but I don't think that was disc. I think it was more erector spinae tendon. So sometimes you can clinically get confused, or it can lead you down the wrong path. I have seen people who have very minor MRI reports, not reports, but very minor disc bulges, and yet their symptoms are extreme. I've also seen someone with a very significant disc prolapse, like seriously bad, and yet she was walking around absolutely fine. She was quite a young girl, maybe in 20s or early 30s, and I sent her for an MRI. She was walking around fine. It was like an achy sensation in the thighs, but no numbness, no loss of sensation, no inability to go for a pee. I sent her for an MRI just because the pain wasn't getting better with treatment, and literally within about half an hour of the scan being taken, the scan center phoned me up and said, we're sending you the results, we need to send your patient to the hospital. And what it was that the disc prolapse was so bad that she was almost one sneeze away from paralyzing herself, which is always an interesting conversation when you try and ring up your patient and tell them they need to go to hospital soon, but without trying to put the fear of God into them and scare them. So MRIs are useful, not always essential. I would only use it as a last resort. Can you explain what is the difference of the supplying purposes of nerves and blood vessels? Both supply organs and limbs, but what does one versus the other? So, this supplying... What do you mean by the supplying, Bowen? What do you mean by the supplying purpose of nerves and blood vessels? I'm going to assume what you're asking is, what is the difference between nerves and blood vessels? Or what is the function of the nerves and blood vessels? Elaborate on that if you can, because I'm not sure if you're asking specifically about discs. So, yeah, a little bit confusing. If you can elaborate on that question, that'd be great. So your other question that you asked earlier is, can the nucleus material of a disc be reabsorbed? The answer is sometimes. It depends on how bad that extrusion of material is. If I go back to my eBook, so if I go back to this, if the nucleus material of a disc was between this second picture and this third picture, so the material was just kind of leaking out, then there's a good chance that you can get that back in. If, however, it was somewhere between this third and fourth picture, then it would be a bit more difficult to achieve. Do you know sometimes if you have a tube of toothpaste and you squeeze out just a little bit too much toothpaste, sometimes if you kind of squeeze the toothpaste tube in the right way, you can get it to suck that toothpaste back in. However, if you squeeze too much out, there's almost no hope of getting that toothpaste back in. That's kind of the best example I can give. Now, how do you get that material sucked back in? One of the best ways is traction. So if you do have lower back pain, hanging from a bar is probably your best bet. So if you grab the bar above you, try and keep your feet on the floor, but then bend your legs. I've actually got a picture of what I mean. Where is that? That's over here. I think I've got a picture of that. This is the second part of my ebook. If you haven't already seen my ebook, for those of you who've not seen it, I thought I put in something about hanging. No. Okay, so if you grab a bar and you just hang from the bar, but you keep your feet on the floor and bend your knees so you can control how much weight is going through your hands, through your feet, that can sometimes put enough traction force on the disc to help it to come back in. Now, this is something that probably needs to be done on a regular basis. It certainly won't hurt you to do it on a regular basis, no matter what your disc and no matter what your back pain cause is. So if it's a disc, if it's a tendon, ligament, you probably won't do much harm. The only thing you could do if it's a ligament, so if you've had a traumatic, say a fall or road traffic accident, that traction could overstretch the ligaments perhaps. But if that was the case, you just feel more pain. So, going back to Bohan's question, I think what you're asking is about the function of the nerves and functions of the blood vessels. So, nerves are... There's a couple of functions for nerves. So one of the functions is a sensory component. So the nerves are designed to detect pressure, or they're designed to detect chemical stimulus or pain, essentially. So that will take the signals from the site up to the brain to be perceived, and then for you to do something about it. Nerves going from the brain to the site of action can cause things like muscle contraction, so they can cause an effect. So in terms of nerves around the lower back or nerves of the disc, they will often detect pain. They will often detect the chemical extrusion of the disc, the nucleus, and that's one of the things that can get sensitized and cause pain. Blood vessels, on the other hand, are designed to supply sites or targets with oxygenated blood, and then carry that deoxygenated blood away from the site. So blood supply is very, very important when it comes to fixing or overcoming and repairing injuries. You need good blood supply. So one of the main things I tell my patients is movement. Movement will help to get your muscles contracting and relaxing. The more you can do that, the more blood flow you get through that area, which means the more it's going to help to push away some of that inflammation. If you're not moving, if you're just staying sedentary, you don't get that flow of blood. Now, it's tempting when you're in pain to stay still. It's tempting to just not move because you're not feeling pain, which is fine. But if you stay like that for too long, as soon as you start to move, it's going to cause you pain. So that's why I always tell my patients to rest for a little bit and then move. Now, one of the questions that people will often ask me is, how much can I move? People with lower back pain often feel better when they're walking. So, as a general rule of thumb, if you're walking for about 15 minutes, I would usually expect the pain to start getting a bit better. I would limit the amount that you walk to a maximum of about 20 to 30 minutes. And the reason is because if you do too much, you're going to work those muscles too much, and it's going to cause too much blood flow to the area, and it's going to add more inflammation. So then when you stop and that blood flow starts to slow down, you are left with a lot more inflammation. However, when you only do like 15-20 minutes of walking, that will be enough to push the old blood away, the inflammation away, but not so much that it's going to cause a lot more inflammation to come to the area. So a little bit of movement is good, and too much is bad, which is why in my ebook just here, I often start people with doing something like the cat and cow. So the cat and cow is a really simple movement that's non-weight bearing, but gets that movement through the spine, gets that movement through the muscles of the lower back, and helps to improve that circulation, but yet isn't going to cause too much strain on the muscles. So let's go back to the old presentation, because it's helping me to think about what I'm saying next. Did what I just say help with the idea of the blood flow, the nerves, the blood vessels behind? Did that help? Hopefully that was answering the right kind of question that you're asking. So I always talk about 3 phases. It works for me in clinic. This may not be the only way of doing it, but it seems to work with a lot of my patients. And I know some of you watching this have already probably seen me talk about this on my YouTube channel. The 3 phases are first of all, when someone comes in, they're often in a lot of pain. So we're talking about acute pain. We're talking about pain 9 out of 10, 8 out of 10. So any movement is incredibly painful. The goal of that phase is just to try and get the inflammation and the pain down. To do this, we need to rest. So as I just said, we need to rest to allow your body just to calm down. Because if you're constantly moving, I've been there more times than I care to remember. If you're moving around and you're in pain, it's just going to wear you down, and that pain is just going to get more and more intense. So you need to rest. When you feel ready, then you need to start moving, but very, very gently. And this is why the cat and cow is such a good exercise, because it's low intensity, it's low weight bearing. It helps to get that movement and helps to get the muscles flowing, not the muscles, the blood flowing through the muscles. Now, as that happens, then we can add in cold. So we can add in ice packs. So that will help to push blood away. It helps to constrict your blood vessels. So your body's trying to hold on to your heat. So that's why the blood vessels constrict, and that pulls blood away from that site. So with that, it pulls away a lot of inflammation. Helps to reduce the inflammation. When people do cold packs, I tell them no longer than 10 to 15 minutes. If you apply a cold pack for too long, you're not getting that blood flow that you need to help repair. So you need to push the blood flow away using cold, but also you don't want to keep that blood flow away because you need that blood to repair. I also recommend anti-inflammatories. Now, this isn't a recommendation to take a certain medication. You must always talk to your GP or pharmacist. I'm not qualified to prescribe medication, so this isn't a recommendation. However, for people who can take it, what I often say is take the maximum that you are allowed to take based on what the packet says. The reason I say that is because a lot of my patients, they always say, I don't like taking medication. I don't like taking pain medication unless it's really, really bad. So what those people will do is they'll just take one, and that will not achieve anything. So what I suggest people do is they take the maximum amount possible according to what the packet recommends. That way we can hit the inflammation as hard as possible, get that inflammation down, get that pain down. But only do that for whatever, like 2-3 days maximum. So that's kind of the phase 1. Now let me just have a quick look at some of these questions that are coming through. Hi Marco, good to see you. God damn it. I'm glad to hear that the continence helped you with your back issues. Marco, if you have any questions, could you maybe do some videos on feet and feet connection? Flat feet. Okay, flat feet we can chat about in a minute. And SS, you got flat feet as well. Okay, so a couple of you got flat feet, so I might as well talk about that a bit later. So yes, we will talk about that. Remind me if I forget. Okay, go ahead. Your question is a good question. I'm going to need to think about that one because it's quite a complex question. Okay, so let's just move on to phase 2. I will come back to your question though, Brian. So once the pain has come down, then we start moving into phase 2, which is to improve the flexibility and mobility. This is the phase where you've been in so much pain up until now that everything has tightened up. Now, if you start to try and strengthen those muscles, they're already tight. So you're going to make those muscles even tighter. So we need to stretch to get those muscles lengthened out. This is also the phase where I recommend people use things like massage guns, massage balls, foam rollers. All of those tools will help to break down tightness within the muscle. So we're using stretches to kind of elongate, to stretch out those muscles. And we're using the other tools, the massage guns, the massage balls, and the foam rollers to break down knots within those muscles. So think of muscle tissue like a load of elastic thread, for example, or elastic bands. If you tie a knot, let's say you've got a load of elastic bands. I haven't got anything here. If you've got a load of elastic bands and you tie a knot in one of them and you've got a collection of them, so one of them is knotted, if you just pull on them, they're all going to stretch, including the one that's knotted, except for the bit which has got the knot in. That knot isn't going to stretch. That's just going to get tighter. Now, it's maybe not the perfect example, but stretching alone is not going to get rid of that knot. What you need to do is focus on that knot to help that knot break down. Hopefully that makes sense. So once we've done stretching, once we've started working on flexibility, that is when we next move into phase 3. Now, phase 2 could last a few days or it could last a few months. Some of my patients are very mobile, very hypermobile, dancers, people with hypermobility. Those people quite often don't need more stretching. If you're already stretching an overstretched joint or an overstretched area, you're probably going to end up with instability. So people who are very flexible don't need more stretching. They can kind of skip straight to phase 3. A lot of guys, myself included, we are naturally a lot tighter. So we tend to need to spend more time focusing on the stretching. Now, once people have got the pain down, once they've improved their flexibility, then we go into phase 3. And this is the phase where a lot of my patients stop. People start to feel better. They get to the point where they feel like they're not in any pain. So they forget about their pain. They forget about the stretches that they've been doing. And they just go back to their normal daily routine. But 3 weeks later, a month later, 2 months later, they end up coming back in because they've re-injured the area because they didn't build on that strength. So that's why strength is so important. So once you've gone through that phase of stretching, the strengthening is the next stage. Now, a lot of people don't know what to do. A lot of people try and do the wrong things, which is why I always start people with the bare minimum. Always good to start with the very basic exercises. So if I pop over to the strengthening, this is why I get people to start with the most basic stuff, body weight things like the prone cobra, and we gradually build it up. So here we've got progressions of the exercises. Then once we've got the basics, then we can start adding in weights. Then we can start adding in resistance, and we can go all the way to the point where we start adding in weights such as single leg Romanian deadlifts, or we can go through and start building up weighted exercises like rack pulls. So all of this is progression for people to start improving the strength of the muscles. Now, people often ask me, isn't Pilates and yoga strengthening? The short answer is yes, they will kind of strengthen you. Yoga particularly will not really strengthen your back. Yoga is more stretch based and works a lot more on the front of your body. So any strengthening that yoga does is more focused on the front of your body. Pilates can work on your back, but the problem with Pilates is it tends to get people to a certain point, but it doesn't push them far enough or use enough resistance to get them strong enough for what their actual back needs. So Pilates is good, but often it's not enough. Right, so once we have gone through phase 3, that is usually where people get much better. So if you follow those 3 phases, that is usually enough to get people out of pain. And as long as you're strengthening, that will get you to the point where it's not going to come back. So if there is one thing you need to do, it's going to be to get stronger. A lot of guys particularly often get offended when I say that, so I always caveat what I say with, listen, I know you're strong. What I'm talking about is this area is relatively weak in comparison to the rest of you. That usually makes them feel a little bit better. So once you've gone through the strengthening, that's usually it, but that's not the end of everything. If you're seeing this right now and you have lower back pain, just drop it in the comments what phase you think you are in right now. Are you in acute pain? Are you working through a set of stretches? Are you working on exercises? And when it comes to phases, it is not uncommon to have flare-ups. Flare-ups will almost always happen, and that is okay. It's not always a linear progression. Now, sometimes you could be doing really, really well. You can get through phase 1, you can do all your stretches, you get into phase 2 and you're doing great. And then one day, I don't know, you sneeze wrong and it goes back to phase 1. That's okay. As long as you follow the principles of going from reducing pain, inflammation, getting that stretching back, if you straight away move into that process, your recovery time will be a lot quicker. So accept it. It happened. Just do what you need to do at the right stage. So if you have had a flare up, don't go straight away the next day to strengthen because it's already inflamed. It's already painful, right? So go back to phase 1 and just follow that process. It might only take a few days. It might take just a week, but that's okay. But if you ignore it, then you'll probably make yourself worse. So we got phase 1, phase 2, awesome. So hopefully, has everything I've said about phase 1 and phase 2 has it helped you guys? Is there anything you want me to go back over regarding phase 1, phase 2, or even phase 3? If there is, let me know. Now, I didn't tell you, well, you might have seen on my YouTube channel, I've had lower back pain. Now would be a good time to kind of tell you my experience of my own back pain, what happened. This was going back probably about 8-9 years ago now. I was in the gym. I was doing squats. I was going through a strength building phase. I'd been doing it for months leading up to it, so it wasn't like I was new to doing squats. I was warming up. I was doing squats with the bar. The weight I was using was nowhere near the maximum what I could do. On something like the second set, I went down, and as I started to push back up, I felt a pop in my lower back. And straight away I was like, oh no, I just feared the worst. I knew something bad had happened. So stopped doing squats, and literally within a minute, within 2 minutes, my back started to seize up. It started to lock up. To cut a long story short, it was the tendon. It was the erector spinae tendon If you want me to show you a picture again, let me know. I'll pull it up. In fact, do you know what? I'll pull it up anyway. It was the tendon, where that white bit meets or attaches to the bone. I put so much tension through that tendon that it just pulled. So think of a tendon like a wire. I'm sure you guys have all seen electrical wire. Usually there's a sheath going around the metal part of the wire. So think of a tendon like that. You've got the connective tissue on the outside that helps to connect it to the bone, and then you've got like the core of the tendon. Sometimes you can get a pop where that core kind of slips within the sheath. That's what I did. That's what caused the pop. And it took me years being in pain. And the reason it took me years being in pain was because I was stupid and I didn't do well. At that point, I didn't have all these phases. I hadn't figured all of that out. So what I did was I rested it. I waited for the pain to get better. And then I went back and did more exercise and I made it worse again. So I took more time off and it got better. And then I went back into the gym and did something else and it got worse again. So it was like this constant resting and then going back, flaring it up again, resting, flaring up. And in the end, I was like, right, I have to do something about this. This was going on for years. And so I came up with, so this is how I kind of developed this kind of 3-phase plan. So I waited for the pain to get better, and then I started to stretch, and then I started to rebuild my body from the ground up. I knew I wasn't where I was. I knew I'd lost a lot of that strength, and sometimes you just have to suck that up and just accept it. So I did, and started to rebuild strength in my body, and naturally it just got better and better. I didn't do anything that flared it up. But there was also something else that was going on. And I remember I was in the car and I was driving to work, and there was just constant like an ache. And I was like, well, I'm not even doing anything right now. What is going on? Why is this pain here? And I'm not even stressing it. So I made a decision to improve my nutrition. At the time, because I was in pain, I was stressed. Because I was stressed eating. And when I stress eat, I like to eat sweet stuff. I've got a very sweet tooth. So my body was inflamed because I was eating so much sugar. So I cut out all the sugar. Literally just stopped eating all the sugar. And within about a week, it made about 90% difference to this constant ache. Now that might not happen to everyone, but the point I'm making is that sugar is very inflammatory. So if you're in phase 1, if you've just transitioned into phase 2, there's still going to be an element of inflammation. So what can you do to help inflammation get better? Cutting out sugar is one of them. We're going to come on to a bit more nutrition in a bit. But I want to just touch on this question first before we get on to the fun stuff like supplements and nutrition. One of my email subscribers sent in the question, what are your thoughts on chiropractic care? Can it support or possibly contradict physical therapy? For you guys who are in the States, chiropractic care is very, very popular. Over here in the UK, it is still popular, but I'm an osteopath and osteopathy is kind of equally as popular, or physiotherapy is equally as popular. So it's not kind of just the one thing like you guys, as far as I'm aware, you guys have mainly chiropractic. There is no right or wrong therapy. I have issues with the way people do things, but that doesn't mean it's a certain therapy. Now, I have very limited experience about chiropractic. I've seen what I've seen on YouTube. I've seen what I've seen by observing a few chiropractors here in London, and I can only base what I've been told by my patients. So that doesn't cover all of chiropractic. So generally speaking, the chiropractic that I'm familiar with is the clicky type, where they get you in, they click you, and that's it. Now, obviously, I'm aware that chiropractic comes in many forms. So please, if you are a chiropractor, I am not making a dig at chiropractic. I'm just telling you what I've experienced. My issue is the people that I have seen who do the clicky stuff and send you away, is that it's not doing anything. It makes you feel good then and there, but these people, and osteopaths do this as well, they can do the same model where they get you in 3 times a week for a 10-minute adjustment, and they get you coming back week after week for say 6 weeks. Then they get you coming back say twice a week for 6 weeks, or once a week for 6 weeks, and then they get you on this model of once a month. If you're going to someone with pain and you're seeing them 3 times a week for 6 weeks and you've still got pain, then it's not working. So I don't care whether it's acupuncture, osteopathy, massage, physical therapy, chiropractic, whatever the therapy is. If you're going on a regular basis and there's no change in your pain, then it's not working. So don't keep going. Right. Hopefully I've said that in a way that hasn't offended people of a specific practice. Manipulations do not change your body quickly. They do not put things back in place. So nothing is out of place. If you're being adjusted, it's not putting your joints back into place. The other issue I have is when practitioners say that problems are stemming from the spine. If you have lower back pain, it's because of your spine. If you have knee pain, it's because of your spine. If you've got headaches, it's because of your spine. If you have ankle pain, it's because of your spine. If you have diabetes, it's because of your spine. When people start saying stuff like that, I find it very hard to accept that. Sometimes it is. If you have lower back pain, it could be because there's a nerve pinched in your back. If you have a headache, it could be because your spine is kinked in a certain way and it's causing the muscles to be tight, to be restricting blood flow. But there's other issues it could be, right? So the way we were taught as osteopaths, if someone has an issue, look globally. Here's a long-winded example. If someone has a headache, it could be coming from their neck, it could be the muscles, it could be the alignment of the spine, but it could be coming from the thoracic spine or the lumbar spine. Maybe the pelvis is at an angle which is putting the rest of the spine out of whack. Maybe someone has stubbed their knee because they walked into a table and now they're limping. Maybe that limping has affected everything higher up, or maybe they've twisted their ankle, or maybe they have, I don't know, tightness in the calf or the ankle, or the ankle was fused, for example. So there's all sorts of things. So this headache may not be caused by the spine. So when people are so fixed minded that every issue is caused by the spine, that's when I have an issue. Right. Do you think that's enough of should I get off my high horse now? Hopefully that makes sense, and hopefully you see what I'm getting at. There's lots of different causes for lots of different problems. It could be spine, it could be nerves, it could be blood flow, it could be a nutritional issue, it could be hormonal issue. So it's not always one thing. Now, speaking of clicks, a lot of people ask me what the clicks are. It's not your bones being put back into place. It's nothing breaking. It is generally speaking, it is the release of air from your joint. So, for example, if I was to click my knuckles, that is air being released from the joint. So I've just clicked my knuckles and I'm trying to do it again. It's not going to happen again. So that means it's the air being released from the joint. It's a bit like those sticky, you know, when kids have like little bows and arrows and they shoot it at a window and it sticks because it's got a little sucker on the front. That is, when you pull that off, it makes the pop, right? So that is kind of like the joints. However, if you are moving a joint, say your wrist, or you're moving your back and it's constantly clicking every time you go into a certain position, that is probably a tendon or a ligament or some sort of soft tissue or even bone that's flicking over another structure. So that's, if it's a bony thing, it's more difficult to overcome. If it's a ligament or a tendon, usually that will go away as you get stronger and more flexible. Right, moving on. So nutrition, lifestyle and supplements, we are nearly at the end. I don't want to go too much more past an hour, although I think I probably will. Nutrition is extremely important. If you are eating an inflammatory diet, a diet high in processed foods, a diet that's high in sugar, a diet that's low in nutrients. A lot of people talk about the SAD diet, the standard American diet. And actually it's probably not just American, it's most of the Western population. Diet that's high in processed foods, beige foods, lack of vegetables, lack of fruits, a lack of quality protein. That can all be very inflammatory. So if you have, let's say, a lower back pain that's constantly throbbing, you always got an ache, you have whatever you seem to do, there's always pain, that could be sign of inflammation. So by improving your nutrition, even if it's just slightly, improving the amount of vegetables or fruits that you eat in place of something sugary such as processed candies or chocolates, pastries, desserts, that kind of stuff. Good quality protein, so grass-fed or line-caught, naturally raised meat as opposed to factory-raised meat will have a big difference. I'm not going to go too much into that because everyone has such different nutritional needs. But essentially what I'm saying is the better you can eat, the more nutrients you have going into your body, the better quality of blood you're going to have. So the more nutrients you can have going through your blood, which means that they can supply the area of damage and help to improve that better. You've got more of the right building blocks. Lifestyle, in terms of stress, in terms of sleep, these will have an impact on your ability to repair. I've touched on it in a couple of videos before, but good quality sleep will help you to repair. If you're stressed, your stress hormones like cortisol are going to be higher. That can have an effect on your ability to repair or your inflammation. Supplements, if you have tightness, if you have inflammation, one of the most commonly advised supplements I tell my patients to get is magnesium glycinate. Magnesium does about 600 different things in your body, so it's a really important mineral, and it's probably the only supplement that you can take where you actually notice a difference. You could take omega-3s, you could take zinc, you could take a probiotic, and you may never even know if it's doing anything. Magnesium, on the other hand, you will notice a difference. So there's different forms of magnesium. The form I recommend for back pain or for tightness is magnesium glycinate. The other form that I often recommend is magnesium citrate. So if you have a tendency towards constipation, citrate would be better. And the reason is because magnesium citrate is not so well absorbed, so it sits in your gut more. So it relaxes the muscles of your gut, hence loosens up your stool. On the other hand, magnesium glycinate is much better absorbed, so it will go into your body, into your muscles. It will help with your inflammation and help with your muscle tightness. For people with muscle spasms, cramps, it will have an almost instant effect. So for people, for example, who cramp at night, have cramps in their calves, spasms on a regular basis, this will have almost an instant effect, and that could be within a day, 2 days, or even a week. So magnesium is incredibly important, and also from a health point of view, it helps regulate your cholesterol, it helps regulate your blood pressure, helps regulate your blood sugar levels. So people with high blood pressure, people with high cholesterol, people with type 2 diabetes or insulin resistance, it can be very useful in those things. So that's pretty much it for the supplements, lifestyle and nutrition. Could clicking be congenital? It could be congenital. It depends what you mean by congenital. It could be a hypermobility thing, which can be congenital. It could be something to do with the formation of your joints. So some joints can be not so well formed at birth, so that can have an effect on clicking, such as hips, for example. But I'm not going to go too much into that. When I exercise for back and hips, I hear the popping or clicking sound. Did you say it's okay? So when you're moving, when you're exercising, so the common one that people hear clicking and popping is something like sit-ups or leg raises if they're doing stuff in the gym. It's okay as long as you don't feel pain. So for example, if I was doing leg raises, or if a lot of people do leg raises, they will often hear a pop in one hip, sometimes both, every time they lower one leg down. It's okay. That's because of an imbalance between flexibility and strength. If it starts causing pain, then just stop. You never want to do anything that causes you pain. So whatever exercises you're doing for your hips, your back, your rehab, if anything is flaring you up or causing pain, whether it's clicking or not, then just stop. Or just reduce the amount of range that you're doing. So for example, with leg raises, rather than going all the way down to the floor, just go down halfway. And then as you build up that strength, then you might be able to go lower and lower. So as long as there's no pain, clicking is okay. So here's a little sneak peek of my lower back pain ebook. I know a couple of you on this call, or a couple of you people might be watching a replay, may have already purchased this. If you haven't already purchased it, this is my lower back pain ebook. It will take you from the acute right through to the rehab. So I've kind of shown you a little bit of that today. But what I wanted to say to any of you is, if you were thinking of maybe buying this, I have a little offer for you, and this offer will also extend to anyone watching this who has already purchased this. So I don't want you to feel left out. If you did want to buy my ebook, if you bought it today or as a result of watching this live, I would like to offer you a free 15-minute call with me to personally help you get to the bottom of your problem or answer any of your questions. I would love to be able to offer you more. I'm not very creative when it comes to offers and sales and all that kind of stuff. It's genuinely just to help you answer your questions or pick my brain for a 15-minute call. It should usually be enough. Of course, if you did want more, we can always arrange more. But if you wanted to buy the ebook from today's live call or the replay, I will offer this a free 15-minute call with me, which at the moment an hour would be about £80, 80 UK pounds. So that's probably about £20 worth of free gift. So hopefully that's a nice little incentive for you if you do want to purchase the ebook. It's at beatyourbackpain.co.uk. Everything I've talked about in today's live is detailed a lot more in the book. So hopefully you might be a little bit interested with that. What I would like to do now is just open up the floor to anyone who has any questions that's been unanswered. Is there anything that you've asked me so far that you want to ask me? Is there anything you want to remind? Did I say anything that I was supposed to go back and answer earlier? If there is, ask your questions now. I know there's a bit of delay, so I'm going to hang around for a bit. But if you're happy with everything I've done and I've answered all your questions, I just want to thank you for your time. I really appreciate it. I know some of you are probably middle of your day, probably a working day as well, so I really appreciate your time. So I have grade 1 lumbar retrolithesis L3, which is a vertebra slip backward on one another. Do you think that doing strengthening exercise of back and hips can release pain later on? So, Tammy, retrolithesis, that's not so. Retrolithesis is not very common. So a listhesis is a slippage of the vertebra. Normally a slippage will go forwards. A retrolithesis is a backward slipping of the vertebra. Now some depends on the extent of the slippage. The more slippage you have, the more serious it can become. Usually it's because part of a vertebra has become fractured, or both parts of either side of a vertebra have become fractured, which has led to the slippage. But for people who have had that for a long time, usually those fractures have healed. Usually it's not a case of a surgery. Sometimes, depending on how bad it is, they will often repair on their own. Generally, strengthening the back and hips will be very beneficial. So I can't guarantee it will release the pain, but if you have a good strong core, if you have a good strong lower back, that will often help things getting worse. So I would highly recommend you do strengthen, but do some research into what you can strengthen, what exercises you should be doing to strengthen. For a retrolithesis, I would imagine a flexion type movement would probably be not a great idea, because usually an extension range of movement for a spondylolisthesis or a forward slippage would not be recommended. So I presume it's the opposite way around. So, Bohan, how come stronger back muscles help to keep the disc nuclei in place? That is a great question. Right, where do we begin? So, let's go back to this model. We have a natural curvature in our spine. 9 times out of 10, or even 99 times out of 100, a disc, the nucleus of a disc, will slip backwards towards the spinal cord. Very rarely will it come out to the front, and that's partly because there's a really thick ligament at the front of the spine. So anytime we're flexing forwards, anytime we're reducing this curve or even bending forwards, that will usually put pressure on the discs, causing the nucleus of the disc to bulge backwards. So by increasing the strength of your lower back muscles, it will help to maintain that extension that you need in your lower back. So when you come to do things like lifting, when you come to do gym stuff, or even just getting out of bed or standing up, having strong muscles will help to keep your back in extension, and therefore help to keep the pressure on the discs so that the nucleus stays within the middle. When you start having a lack of stability or a lack of strength, you're in less control of what happens in your lower back, less awareness as well. So you're more likely to do something that involves flexion, and that will end up causing the nucleus of the disc to bulge backwards. Not only that, but say you come to sneeze. If you have strong core, if you have strong back muscles, you can brace. So you can brace and prepare for that trauma, well, not trauma, but that pressure from a sneeze. So it just helps to protect your spine and keep it in a more optimal position. So hopefully that answers your question. If it doesn't, let me know. Right, flat feet. Now this is an interesting one. In my kind of field, so as a practitioner who deals with people in pain, in our industry, we often look at flat feet as a problem. But that isn't always the case. The problem isn't that it's flat. Some people are just naturally hypermobile. They've had flat feet all their lives. So in those cases, it's probably not always the cause. It's just a variation on a spectrum of flexibility within joints. The problem can arise maybe though if you've gone from having, say, structurally normal, and when I mean normal, I mean like the standard kind of natural arch. When you've gone from that to all of a sudden you've developed maybe one foot that's just dropped, that will have an effect on your ankle, that will have an effect on your rotation through your thigh, through your hip, and that will put strain on your lower back. So in those cases it could be a problem. But if you've had flat feet all your life, that may not necessarily cause lower back pain. It often indicates though, people with flat feet tend to be more on a hypermobile spectrum. So they tend to be a bit more mobile within joints all around the body, elbows, knees, even in the spine. So for those people, I would advise generally strength training is probably very important. If you want to try and correct your flat feet, you can. There are exercises that you can do. I'm sure there's plenty on YouTube. I haven't done any myself, mainly because it's not something I tend to work on that often, or not something I tend to make it much of an issue of. But yeah, if you want to strengthen your feet and try and correct the arches, it's said that it's possible. It just depends on how mobile your joints are. Hopefully that helps. If you have flat feet, don't necessarily worry. I would focus on strengthening up the lower back as a priority first. Good support in tennis shoes. Yeah, so footwear is important. Even the insoles you have are important. And for any of you watching this, insoles is another thing. If you put an insole in your shoes, you're supporting your feet structurally. You're putting a wedge underneath your arch and you're causing an artificial arch. What that's doing though is it's encouraging your body to be lazy. So when you say forget to put your insoles in one day and you don't have that support, your feet are so used to not having that support that they've become so lazy that they'll just collapse. And this is the same with other devices as well. So in the kind of fitness industry, you'll see people using weight belts to do things like squats and deadlifts. You need to be improving the core as well. If you're just relying on an external source like the belt, you're potentially training your body to be lazy. The other thing that people ask me about is these posture correctors. I don't know if you guys have ever seen them. They're like a strap that you kind of put your arms through and then you can tighten it up and it pulls your shoulders back. My answer to those is I think they are maybe helpful in the short term because they remind you, so as you start to slouch you can feel that pulling on you, so it reminds you to sit up straight and hold and maintain that posture. However, if you start to rely on that, those muscles in your back are becoming weaker, which means that when you don't have your posture corrector on, as soon as you go back to work, you'll be like this, you'll be slumping down. So it's always a better idea to strengthen where possible and use external supports just as a reminder, but don't rely on them. Right, guys, I think I've kept you all long enough. Honestly, I appreciate your time so much. I'm really, really thankful for you all for watching any or all of this live stream. Let's get back to doing this on a regular basis. I'm going to aim to do a live stream once a month. I know maybe you guys watching just have lower back issues, but if there's anything else you want me to do a live stream on, let me know, maybe in the comments or in the replay. But I'm going to try and aim to do a live stream once a month, partly because I also want to get to know you guys and help you guys out on your journey to improving as much as we can. So once again, thank you so much for your time. Have a good afternoon, day, evening, whatever time it is. And I will see you on my emails or in the comments. Have a great day, and we'll see you all soon.